Hi, everyone. We're Dogtopia. My name's Tony, and this is our veterinarian, Dr. Antje Joslin. She has over 16 years in the veterinary field, and she practices out of Phoenix, Arizona. We're so excited to have you here today to answer all of these doggy health-related questions. Thank you to everyone who submitted either on our Facebook page or www.dogtopia.com/healthydog. We have your questions and your answers, so we'll just jump right in. If you do have more questions that come in throughout the Facebook Live today and we can't get to them, feel free to submit them at dogtopia.com/healthydog, and we will get them added to our FAQ section. So here we go. You ready?
Yep, there you go.
Okay, thank you. This is from Pam from our Healthy Dog Central site. How do you know if your dog is suffering from dry eye?
That's a great question, Pam. Let's start by just talking about what dry eye is. And dry eye is when your eyes don't make enough of the watery portion of the tear film. It's an inflammatory condition, and the little guy's eyes try to make mucus instead to kind of coat those eyes. So you'll get a lot of dogs that have red, irritated looking eyes. They'll rub their face on objects. Sometimes they'll rub their face on the carpet or paw at their face. You'll see that they get little periocular dermatitis where it's like red and loosen the hair on the eyes, and you'll see a lot of like eye boogers, kind of mucusy looking stuff in there. Hopefully it'll just be kind of gray or white and not infected looking where it's yellow or green. But that's kind of what you're looking for. There are certain breeds that definitely are predisposed. So we'll go real quick through those. Those would be like the English Bulldog, the Westie, the Lhasa Apso, Pugs, Cocker Spaniels, Pekingese, Yorkshire Terriers, Shih Tzus, Schnauzers, Boston Terriers, Dachshunds, Chihuahuas, German Shepherds, and Dobermans. So if you have one of those breeds,
I have a dachshund who's got some dry eye.
they're kind of predisposed. And a lot of them are the ones that have kind of the smush face, the brachycephalic breeds sometimes, or the ones with the real big eyes. They'll be a little bit more prone. But really any dog can develop dry eye. And sometimes there's medications that they take, or they'll have some underlying medical conditions that can kind of predispose them to having dry eye. So when you have it, like I said, you get that kind of mucoid discharge. But when you look at them, the cornea a lot of times is not really pretty. It's not a nice, shiny, reflective cornea. You kind of get a dull cornea, and it looks like the eye's a little bit dry. I mean, literally. And they've lost that reflective quality to their cornea. Sometimes dogs that have cherry eye, so if you've ever seen a cherry eye, it's kind of the gland of the third eyelid pops up, and it's like they call it cherry because it's a little red protrusion in the medial canthus of the eye, and that actually helps produce tears. So dogs that have chronic cherry eye a lot of times will have dry eye as well. Or dogs that have had their that gland removed surgically will have dry eye. So those guys have it. And
so it can be done about dry eye.
Okay, so pretty good news is that it's easily treatable for most dogs. So if you take them to the vet, there's a couple easy tests that most veterinarians can do in their office and diagnose dry eye. And there's a couple medications that we use. Your veterinarian will choose one, and hopefully that will work. There's a couple, sometimes we do a little playing around with different medications and find the right combo or one that works for the dog. But it is usually a lifelong thing. So I tell owners, it's well managed, easy to manage. You have to be willing to do some medication every day. Most dogs tolerate it really well.
Is it an eye drop?
An eye drop or eye ointment, yep. And most dogs tolerate it well. Once they're used to it, they get maybe a little treat afterwards. And it is usually a lifelong treatment.
Okay, thank you. Thank you, Pam, for that great question. All right, this is in coordination with Kathleen Donahue. Thank you for submitting your question on Facebook. What is your opinion on the necessity of teeth cleaning? Her 7-year-old Morkie is due to go next month for a procedure, but she hates the thought of her dog being under anesthesia. So do dogs need dental cleaning? What's your stance on that?
Yeah, so for sure, dogs do need dental care, and usually that involves, for the vast majority of them, some type of dental cleaning under veterinary supervision. So just like we do, they need hopefully some regular care. We always try to get people to brush their dog's teeth or use a dental toothpaste or dental rinse There's dental diets, dental chews, all sorts of good things that you can use. But just like with us, they build up tartar on their teeth. 80% of that tartar is made up of bacteria. It causes inflammation, just like it does in us. You get gingivitis, red irritated gums. It can damage the tooth. It can damage the underlying ligaments that hold those teeth in place. You can get loose, wiggly teeth. It can lead to infection, in those teeth. And then sometimes that infection can even spread in the bloodstream and, affect our heart and liver and kidneys. So it's really important to take care of those teeth. We try just like humans. We try to encourage starting early. Sometimes we'll get those dogs in that have had years and years of dental disease and have pretty infected mouths and a lot of pain. And, then it's pretty intense to clean those. And oftentimes they lose their little teeth. But so the reason we encourage dental cleaning and brushing is that, we don't want it to progress to that state. So if you can catch it early, do routine cleanings with your dentist, and then kind of follow up with at-home care. Make sure that we keep as much of that tartar and inflammation at bay. And when you go to your dentist, like she's going to have her dog's teeth cleaned, they will do hopefully x-rays. And with the x-rays, you can also see, just like with us, you see that the majority of the tooth is underneath the gum line. So those roots and everything make up more than 50% of the tooth. So it's important to get those x-rays and see what's going on under the gums. If there's any infected roots, if there's any things like that where they may need to be removed, or sometimes they'll refer you to a veterinary dentist if that's an option, if you need a root canal. And it's getting pretty advanced for dogs. We have dogs that have crowns and
that's crazy.
Some of our working dogs that need to use their canines will have nice gold canines. So all sorts of things that can be done. But for the average pet parent and the average dog, having a good relationship with your veterinarian, taking annual or every 2-year dental cleanings, whatever your dog needs, and then at-home care is important. The little guys, and hers is a Morkie, so the little guys kind of are a disadvantage for dental disease. We see much more and more severe dental disease in small dogs. They tend to have bigger teeth for their little mouth, so they tend to have more crowded teeth, and it kind of holds the debris in between the teeth, and hence a place for the bacteria to grow. They aren't as often big chewers like some of the big dogs do, so sometimes they don't have that natural tendency to help keep their teeth clean. That being said, the big guys tend to have fractured teeth more. They're chewing too much. Chewing on things that are way too hard, chewing on sometimes rocks and bones and that kind of thing. So I always tell owners too, when you're picking dental treats, pick things that have the VOHC seal. So it's a Veterinary Oral Health Council. It's kind of like the Good Housekeeping seal for dental products, and those tend to be the right toughness, if that's the correct word to use. Like, they're not too hard to fracture teeth. They're not too soft that you're just done with them in like 30 seconds and on to the next treat. So her question specifically asked about anesthesia. And of course, anesthesia is not risk-free. I always tell people there is a risk of, again, sometimes can be severe risks, but anesthesia has come such a long way in the last few decades. I mean, there's the preoperative evaluation, there's preoperative blood work to make sure that all the liver and kidney functions are working, that you can metabolize the anesthesia. Hopefully your veterinarian will go over all that with you ahead of time. We have great inhaled anesthetics anymore. We don't have to only use the injectables like we did way back when. We do all this monitoring. There's IV fluids, there's monitoring the heart and the blood pressure and all those things. So make sure that that's something that your veterinarian's doing and that you're comfortable with, and we can totally minimize, the majority of the risks, and hopefully she'll be comfortable.
She should be okay. Yeah. Good luck.
Good luck. Yeah, for sure.
So thank you, Kathleen. We hope that answered your question, and keep us posted on your Morkie. This question came from Kathy Woodfin via Facebook. Thank you, Kathy. Her puppy was spayed last Friday. When can she start going up and down stairs? She says she's so bored. Do you have any ideas on keeping her busy while she still has to wear the cone? Everyone hates the cone. Cone of shame.
Oh, yes.
She says she's tried so many different types of toys, bones, etc. She's 6 months old and normally extremely active.
Well, good question, and good that she's gotten spayed, got that out of the way, and she will be quickly on her way to recovery. So really the first week is kind of the critical week where you want to make sure she's not running and jumping and playing hard. So it sounds like she's a couple days out now, so she can certainly have controlled leash walks, and that includes going up and down the stairs. You can, if you're controlling her, so holding onto her collar or holding a leash, letting her walk up and down the stairs normally. We don't want running, rambunctiously up the stairs.
So take it easy.
Yeah, so slow, like a walk up the stairs should be fine, and a walk down the stairs. So if you can control that, if she needs to go up and down the stairs. But, she's almost kind of out of this first week. Sounds like she's headed in the right direction. You do need to keep the cone on her, because I've had my fair share of, I couldn't leave the cone on my dog, and then all of a sudden all the stitches are out, or they've really kind of made a mess of their incision. You just don't want to go down that road. So a couple days of, being a little bit bored, maybe giving her, like you said, the 2 toys. It's a short window in the life span of hopefully a healthy lifespan for your dog. So, you can take her for walks for sure. Just, as long as she's on the leash and just walking. Keep her with you, petting her, letting her sit on the couch with you, I guess, maybe this time.
A little spoiled during this.
But like you said, the dental chews and toys, and hopefully she'll get clearance pretty soon. She'll probably go back to her veterinarian and have a check of her incision, and if that's healed well, or if there's sutures or staples that need to come out, once those are out, hopefully she can get her cone off and be back to
rambunctious self.
Yeah.
Sounds wonderful. Thank you, Kathy. All right, now let's get into some tick questions.
Oh, yeah. Okay.
Everyone,
hopefully it's not tick season. Well,
not yet, anyways, right?
Up here in Arizona,
we skip it a little bit.
We do, but we have it all year too.
Yeah. All right. How do you check your dog for ticks?
So I always tell people, especially if you live in a tick-prone area or a woodsy area, whenever you go outside, take your dog for a walk, you come in and kind of give them a pet, like you normally would, and kind of go over the back and underneath the belly. And if you have a really thick hair-coated dog, sometimes it's good to go against the grain a little bit and start there. And feel for any kind of lumps or bumps. That's what you're looking for when these ticks are attached. It's real hard when you just went out for a walk. They can still be on the hair coat, so you want to kind of look for across the top of the hair coat. But they love to hide in warm, dark places. So places to look are around the ears, like behind the ears, around the ears, in the ears. A lot of ticks, if they've been there for a while, have made their way to the ear. You want to look into the ear canal. I mean, you can't look too deep, but in the pinna of the ear. And between the toes is another favorite place for the ticks. So in between the dog's toes, just kind of spread them, look in there. You kind of want to look in the armpits, in between their thighs. And then the other place is you want to lift up that tail and kind of look around that area and kind of between the tail and, the reproductive area, making sure, that the ticks
didn't make a home.
Make a home in there, yep. Mm-hmm.
So you mentioned the lumps. So what are the other warning signs that your dog has ticks?
So that's a good question, because sometimes there's no warning sign that your dog has ticks, right? They're just kind of happily doing their thing, and they're not necessarily itching or chewing or anything, and you're petting them and you're like, oh, what's this bump? And you find a tick. But some other warning signs are, of course, if you see any in your house or near the bedding where the dog likes to lie. If you're walking across the kitchen floor and this little black thing is walking across there and you use a tick, then it's of course a good sign that someone brought it in, and that might be a place. What else are we? The yard, kind of the same thing. They can be out there, but if they're more on the areas where you're hanging out, the porch, the patio. If the dog has an outside bed, for sure, you want to shake those out and wash those pretty frequently. The other thing is if you don't notice a tick, but you're noticing like an occasional red spot on your dog, or it's raised, or there's like a scab, that could be a place where a tick has been. Yeah, for sure. And again, if you're noticing your dog shaking his head or kind of pawing at his head, there's not, it doesn't look like there's ear infection, there's no smell, you might want to have a veterinarian look in there, because there's definitely some ear ticks or
irritation of some sort.
Or they could have gotten into the ear.
Okay, so how do you know what a tick is versus other insects?
Okay. Yeah, so ticks are, they can be really small, like seed ticks, and they can be, a millimeter, 2 millimeters, pretty small, all the way up to a couple of centimeters, especially when they've had, blood meal and they're big and swollen. They have 8 legs. And so, that's kind of a little bit of a hallmark. Yeah. They have a big, an oval-shaped body that can really swell when they have a blood meal. They can be anywhere in color from like a whitish cream color to a red, brown to, varying shades of brown. And some of them have markings, so you can go online and kind of even look, depending on the area you're in, if they have markings on their body. The head section is kind of where they attach to the host, and they definitely do not fly or jump. So if you're seeing them flying around or jumping, it's probably not a tick.
Okay, that's good to know. And so as a pet parent, what should you do if you notice a tick or you see that your dog has ticks?
So if you're noticing a tick, you want to remove them as quickly as possible. I usually tell people wear gloves. If you have a pair of tweezers, that's ideal. You want to get right down to the base where the tick meets the skin and, get that part of it and remove the tick by grasping it, kind of pulling it off. Then you want to check the area to make sure, that you haven't any remains of the tick on your dog.
Okay.
So you don't want to just pull the back of it. You kind of want to get close to the base where it attaches. And then, if you're seeing a lot, you want to, of course, talk to your veterinarian and get a protocol in place, and also talk to your veterinarian about what diseases the ticks in your area carry, and then what kind of testing you might need to do. So every region of the country has different tick-borne diseases, and they have different things you need to monitor for and or treat for. So
good information, definitely. Is there anything else about ticks that you want to share?
So
maybe the medications you recommend?
Something? So there's some really great newer medications that I like a lot. We've had some really good feedback and success with them. So there's two products. There's the NexGard Oral, which is, like I said, an oral medication that you give to your dog, and it works for a month. And you can give it to dogs that are 8 weeks and older and at least 4 pounds. And then the other one, Bravecto, it's also an oral. They have a topical version as well, and that's for dogs 6 months and older or heavier than 4.4 pounds. And that one works for up to 12 weeks in ticks. There's a couple ticks where it only works for 8 weeks, but for the majority of ticks, it works for 12 weeks. So that's a great option. I always tell people, they're not just a nuisance for the dog. They can carry diseases that people can get as well. So you really need to be on top of it if you have a tick problem. Talk to your veterinarian. Yeah. If it's a recurring problem you can't get under control, you need to do some measures to take care of the house and the yard. And then, of course, anytime you're outside with your dog or out camping, especially, check yourself and your dog for ticks.
Good to know. All right. See, here is another question. My dog is 3 months and had his first vet visit. How often should the dog and the pet parent be seeing the vet after that?
Okay, so if you're 3 months old, 12 weeks, it's the first visit, your vet will go over with you what vaccines hopefully they'll be doing that day, what kind of deworming schedule if they need that, if they need a fecal sample submitted, and all those kind of fun things that you're going to do for a new puppy. And then you're going to, have a conversation with what kind of vaccine schedule you're going to want. Some people like to spread them out more. Some people want to get it all done with pretty quickly. So you're going to need at least another visit, but, possibly two, depending on what protocols you decide to follow on that. But that's kind of how it's going to go. And then hopefully you'll also talk to your veterinarian about your spay neuter program, what age you're going to want to spay them and when in that first year or so that you're going to have that done. And hopefully after all that's done, you'll be healthy and just come for your annual or biannual visits. And then you can sign up for
Dogtopia.
puppy daycare and puppy playing at Dogtopia. So we'll be ready to go.
Thank you. Let's see. And another question related to puppies, is there one best food that you recommend? Or
okay. So we kind of, and I see there's another question a little bit about how often they should eat. So for puppies, you want to do a couple meals a day. Once a day usually is not enough for puppies. Okay. They tend to, need to have their food.
They're growing.
Yeah, they're growing. And especially like the little small breed dogs, they can drop their blood sugar pretty quick. So you want to do, 2 to 4 meals at least. I like when they're real little, 4 meals, and then kind of move it to 2 as they grow into adulthood. And, there's so many awesome pet foods on the market now. So there's not necessarily one specific one that I'm going to want to recommend, but really, talk to your veterinarian about what special needs your dog might have. If it's a large breed dog that needs large breed puppy food, if there's any other underlying health issues that puppy might have.
Lots of factors.
Lots of factors, but lots of good choices.
Okay. And then let's see. There was a question that came in about sneezing, which is interesting. My dog sneezes a lot. Is it because he's excited or is it an allergy?
That's a really good question, and I don't get that one very often, but we did a little research on all the things that can make your dog sneeze. So there's a whole bunch of them. So an occasional sneeze, just like we do once in a while, you're going to sneeze because something's irritating your nose and you need to get it out of there. So an occasional sneeze or two in an otherwise healthy dog really is nothing
to worry about. Okay.
But if they're frequently sneezing, it's repeated sneezing, if the dog is acting ill at all, lethargic, if there's discharge, any of those things, you definitely want to, take a visit to the vet. They certainly sneeze for many reasons. You can, as you know, dogs use their nose for sniffing around a lot, so they can inhale all sorts of irritants in there, foreign bodies, and then of course that's the body's way of expelling that, is just this forceful sneeze that gets things out of the nasal passage. So dogs can get, frequently inhale irritants and allergens and things into their nose. If it is a true allergy and they're sneezing a lot, you can treat that like we do in people, if they have a grass or pollen allergy. In dogs, allergies also manifest themselves in many other ways, skin irritation, so that's not by no means the only way, but certainly something that can happen. There's another kind of gross one. Dogs can get nasal mites.
Oh.
So they're like little mites that live in their nose, and as you can imagine, they're probably pretty tickly and itchy and make them sneeze. They are transmitted, usually nose-to-nose contact from other dogs, but luckily they're not very common. And I think in all the years I've been practicing, I think I've seen them twice.
Okay.
So luckily, and every time we're like, oh my gosh, that's something cool. We don't see very often. And they're easily treated once discovered. So not a huge concern, but it's just something to think about it. The most common things that we see with dogs that are frequently sneezing and not feeling well, of course, are viral or bacterial or fungal infections, just like we get, and some of them we vaccinate for, some of those infections, and we have a whole bunch of information on the website about vaccines and what they cover. So some of those illnesses can cause sneezing, but there's other ones out there. And on the list as well for sneezing is tooth problems, like we talked about earlier. So in our upper arcade, our roots kind of go right up into that area. So if you have a tooth root or a painful tooth that's kind of pushing up there, and you can imagine
it's all connected,
make you sneeze. Of course, so we have nasal tumors, so there's cancer that can do that. And then for some dogs, interestingly enough, sneezing can be a calming signal.
Oh, interesting.
So if they get nervous or worked up, they'll sneeze, and it's just kind of like similar to when you see them yawning a lot. That doesn't necessarily mean your dog's tired. That's kind of a calming behavior, or the lip licking. And of course, when they're excited, they can sneeze a lot. So dogs that get excited sometimes do this smile where they pull their lips and teeth back, and that can kind of stimulate a sneeze. Of course, bug bites or rolling around on the carpet or those kind of things can all make them sneeze. So it's not a commonly asked question, but there's lots of things can make your dog sneeze.
Wow, I had no idea.
Yeah.
We have a few more minutes. Let's get through some of these other questions. What is a healthy weight for my dog?
Oh, good question. So
lots of factors as well.
Yeah. So I'm going to start this one out by maintaining, there's a study that came out, Purina did. It was a 14-year-long study that looked at dogs that were fed to their ideal body condition lived 1.8 years longer than their litter mates that were overfed. So the ideal body condition is an important thing. Like, you really need to make sure that you're trying to keep your dog at a good weight, because we see, just like in humans, that there's so many factors that being overweight can contribute to, an illness, and obviously in longevity, that study showed pretty clearly. So how do you know? In this study, let me tell you, their ideal body condition was that you could see or feel the dog's ribs.
Okay.
That when you looked at them from above, there was a tuck in the waist, and when you looked at them from the side, there was a tuck in the waist, right in front of them. Okay. Yeah. So when you're looking at your dog from the side, there was a tuck in the waist, like right in front of the back leg. So these dogs all had a good body condition.
Yeah.
And so in the U.S., unfortunately, like 54% of our dogs, so more than half of them are considered overweight or obese.
More than half?
More than half. Wow. So we've got a lot of little chubby
dogs. Too many treats.
Yep, too many treats. And most owners don't even recognize this in their dogs. Like 91% of dog owners don't recognize that their dog is overweight. So, we're trying to do a lot of education on that. If you want to do a Google search for body condition score, you can come up with a lot of great charts that you can look at and kind of decide, where your dog falls in there. Lorraine gave a talk last week on our question and answers, and she mentioned the Pet Nutrition Alliance, and they have nutrition information, but they also have a great body condition score on their website. So go ahead and check that out if you want to take a look and see, where your dog falls and where he should fall. And when you go see your veterinarian, ask them when you go on for those visits, hey, how does my dog look? Where are we on the body condition score? Because it's so much easier to make small adjustments, every year, every 6 months in your dog's food, instead of walking in one day and they're like, you gotta lose 30 pounds, 20 pounds, which is not uncommon. There's some big dogs that come in and they're easily 20 to 30 pounds overweight, and that's a lot of weight to lose. And in addition to just diet, there's also exercise and mental stimulation. So those are super important to keeping your dog fit and healthy. And, Dogtopia is a great place to do that.
It is.
Your dog, while you're at work, whatever, you can be interacting with other animals, getting exercise and, that mental stimulation, which is going to be, that's kind of a new thing coming up that we're going to see in animal health. There's been quite a lot of study in that. Wow. So, yes.
Good information.
Yeah.
All right, our final question. Do you recommend pet insurance? Probably a pretty new thing that you've been seeing lately.
So pet insurance has been around. It's becoming a bigger player in the marketplace, I think. There's more large companies getting involved in pet insurance. I think it's a great way for people to help manage their pets' healthcare costs, because sometimes we're not good at setting our own money aside out of our budget to come up with those unexpected things. So definitely not a bad thing to consider. There's lots of different products out there. So I always, people have to kind of be a savvy consumer, and they need to understand. You need to understand what you're buying, what is being covered, how they're going to reimburse you, because it's not one of those things where you usually go to the vet and you don't pay. Like you pay and then most places, you pay and then you have to get reimbursed. So you want to know how they're going to reimburse you, what you need to submit for reimbursal, because sometimes there's a lot of paperwork involved with those. So I just tell people, make sure you know what you're going to have to do, and understand the difference between insurance and then wellness or health type plans.
Okay.
There's a lot of clinics and some larger chains that offer, wellness or plans or healthy dog plans, which are great too. They offer, they cover your dog's vaccines. They may include their annual blood work or their fecals and their spay and neuter. So those are one route to go. And then in addition, you may choose to do that and get insurance, because most insurances cover emergencies or illness. There are some out there that do health and wellness and emergency type things, but no,
health is your wealth, so that works.
health and wellness and emergencies. Yeah. So really just kind of make sure you read the fine print, know what you're paying for, and then know, what you have to do to submit, because otherwise it can get kind of frustrating.
All right. Well, thank you everyone who tuned in. We were able to get to pretty much everyone's question. Oh, Bill, my Vizsla eats a ton. It's tough to keep weight on him. He plays so much. Yeah, that can be the case for some breeds.
And some, definitely Vizslas are one of those breeds that they're active and they tend to run a little thin, which is fine. It's not, you want to make sure your dog's not too thin, undernourished or malnourished, of course, which, is hard to do if you're feeding them pretty regularly. It's just like some humans,
faster metabolism.
Faster metabolism. If he's eating well, a well-balanced diet, and he's really active, he's probably really healthy. Kind of err on the side of we're kind of learning that it's better probably to err on the side of being a little on the thin side than being on the heavy side. So
nice. All right.
Our grandmas wouldn't like this. They always like to fatten up their kids. Totally. Same with their pups, but for their health, it's probably good. It's probably normal.
It's a Vizsla, beautiful Vizsla. All right. Well, thank you everyone, and thank you, Dr. Joslin, for coming in today. We really appreciate it. We hope you got to everyone's questions. If we didn't, we'll add all of these questions and answers to dogtopia.com/healthydog in the frequently asked questions section. And our next live session will be next week with our animal behaviorist, Colleen Demling. It will be at 7 p.m. Eastern, so we hope that you can tune in, submit any questions you have related to dog body language, dog park etiquette, things like that. If you're getting a rescue dog, certain questions you have on training your dog, she'll be able to answer all of your questions. So we look forward to seeing you all again next week. Thank you.
Thanks.